This seminar marks the beginning of a series of such events, which I'm holding to help me formulate views about the lessons to be learnt from the distressing events at Stafford Hospital over the past few years. Each seminar has a loose overall theme, and today's focus is on regulatory methods. We've invited you here today as people who seem to us to have relevant and helpful experience to bring to the table.
Well, when looking back over some considerable period in terms of regulation in healthcare, amongst the many features that have worked include a fundamental concern with the quality of patient care, with the patient experience, and understanding how that is provided to a very high standard or not. And then using high quality analysis, often measuring elements of the process of care as well as measuring the experience of patients.
Your primary focus is on outcomes for prisoners. Some have said it's very difficult for inspectors to look at outcomes. They can only look at systems and processes. Yet your focus is primarily about outcomes. How do you go about it?
Well, we're absolutely focused on outcomes. Some outcomes you can measure. Do people have somewhere to live when they leave the prison? Are people safe? Are they in other violent incidents? Others, sometimes you have to look at kind of proxies for the outcome. If these processes are in place, you'd expect the outcome to be achieved. But we absolutely start from what's actually happening to prisoners in this place. And if they weren't right, then we would look back at what are the processes that maybe that were going wrong that contributed to that.
We then talked about the difficulties in a regulatory system that's moving on, of organisations moving quite quickly and potentially leaving regulators behind. And one of the ideas coming out around the value of peer review, using people from the field that can benefit from that experience, take that back into their own organisations, as well as using, leaving behind valuable observations to the organisations that they review. We've heard from the discussions this morning that there can be a risk where the inspectors have a different level of experience and lag behind the experience of the inspected. How do you assure that problem doesn't arise in the Prisons Inspectorate?
Well, about half of our inspectors are seconded prison governors, so senior prison governors who come to us for a 3-year secondment. So we want people who've got up-to-date operational experience. But it's important, it's not just them, that's leaven by people from other professional backgrounds, and in the end, the conclusions are mine, not the inspectors. And I think that's that mix of seconded governors and permanent staff is important for our credibility and effectiveness.
We've had a lot of interest today about your process of peer review. How do you ensure that you get the right people with the right experience to undertake these roles?
Again, it's what I'd describe as practice what you preach. My observation would be that when we send people on peer evaluations, you have to send them off with a pre-job brief which says this will be good for you. You will learn a hell of a lot, and when you come back, we want you to deploy your learning in the organisation.
Does peer review work where there's an element of competition between organisations?
Yeah, we see it internally. We operate 8 power stations, and we have league tables on many of our key performance indicators, and it is a driver. There is that element of competition, provided it's managed in an appropriate way, can be a very powerful driver for change.
Would this work more effectively as part of the regulatory system or in parallel to it?
My experience can work in both ways. Personally, I think the peer review exercise is better to be a separate endeavour to inspection, but nevertheless I think it's very important that the inspectorate has the benefit of contemporary doctors, nurses, allied health professions and managers to inform their judgments given contemporary practice.
We heard about regulatory alignment but not structural change, and the importance of regulators trying to coordinate the way that they work and also look at systems, not just organisations.
We then talked about the fact that it's about it working as a system. The debate that was coming up this morning that we were hearing about earlier. Essentially that the system, regulation, works as a system, and here I'm adding in a comment to try and illustrate it, which is, first of all, that is sensitive enough to pick up what is relevant, and specific enough that what's picked up is genuinely relevant.
The other issue is that because we have multiple standards, protocols, guidelines, audits, research, numerous things that tell us how things should be done. And actually, if we just stopped today and started to implement all of those things, we might get a long way.
Thank you very much. It was only to say, in terms of behaviour, I think there's something about speed, which was the point I wanted to make before, that if there were ever a problem, like BidSNAF, detected by whatever regulator in the system, that they should be capable of moving with speed and in a coordinated fashion. If it is with another regulator, that they talk together but move with pace. I think it would be unfortunate if there were another issue where people were arguing, pardon my French, arguing the toss about who could do what when and the evidence base that they needed before they could intervene. I think patients would expect timely and swift regulation, even if it were only a temporary measure. There's something about that and how they behave.
We've also heard about the primacy of boards and the accountability systems that they use to assure themselves of quality and the reliability of evidence.
I think fundamentally the place that has the responsibility for making sure that transparently patients receive high quality care is in the boardroom of the individual organisation. First and foremost, every day that is their responsibility. The regulator has a very important supplementary role to provide some reassurance that that's the case, and where it's clear that they find deficits, then the regulator must intervene appropriately and ensure that the organisation improves its services.
I'd like to slightly disagree with this idea that you have to have lots of external regulation or leadership from the board to come to that. I think the leadership has to come from the senior clinicians, because if the senior clinicians are not engaged in the process, you're never really going to change the culture in a hospital. And I'd like to just draw, the word consumer was mentioned. I'd like to just draw a parallel between consumers and consumers. In the private sector, and I'm talking about the hospital private sector, the consumer are two people. Actually, the consumer is the consultant, because if you do not respond to the consultant as a hospital, he will take his work elsewhere. The consumer for the consultant is the satisfaction of his patients, because if patients go away and criticise the consultant, he won't get any work. And there is a very different ethos to the way things are done in the private healthcare sector. It's not all wonderful by any means, but it does keep the consultants in control, and it does mean that the consultants actually have responsibility for the way that hospital works.
Well, to be clear, the people who are responsible for making sure prisons improve and that things don't go wrong is the prison management. It's absolutely not us. So one of the features of the way we work is we are absolutely not part of the management of the prison service. So what we do is we hold up a mirror, we tell people what's actually happening on the ground in the wings to the prison and to the outside world. We tell them what we think should be done to improve it, but it's up to them whether they do that or not. We'll go back and we'll look and we'll see whether our recommendations have been used, and if they haven't, then we'll have something to say about that. But in the end, the responsibility for putting what we say into practice or not rests with the management of the prison.
We heard also about the importance of organisations setting global aspirations and standards, but not losing sight of the basics.
You have a set of standards that are set by the Chief Inspector of Prisons. Who else do you involve in setting those standards?
Well, our standards are referenced against human rights standards and sort of international prison norms, and have been built up over time as a result of our own experience. We consult about them and we keep them under review. And what we aim to do is have standards that stretch prisons, but aren't so far ahead of what they can actually do as to feel unachievable.
We talked a little bit about excellence. So patients might be interested in messages about excellence, not just achievement of minimum standards, And perhaps that's where service accreditation comes in, and particularly in a market-based competitive environment, organisations might well want messages about their maximum achievements, not their minimum achievements, broadcast.
I think if standards are too aspirational, they just get ignored. They're so far removed. So I think the right answer is to have stretched standards. If you can move the worst quartile up to the best, we would save thousands of lives tomorrow if just the worst performing providers did as well as the best currently in the UK.
And of course regulation wouldn't be necessary at all if, as our speakers kept on reminding us, boards fulfilled their responsibilities in the leadership of their organisation. If that happened, then you wouldn't need regulation, but unfortunately you do need regulation because sometimes that boards don't fulfil their responsibilities, and I think you also need it because at the moment at least the public will not trust the service unless there is some form of demonstrably effective regulation, and it seems to me there is a challenge that we've recognised in this room, that there are aspects of the current system that aren't meeting that requirement at least. Whether I can help put any of that right, time will tell, but it will certainly be something I will try to do, and you've certainly done your best to help me today. So thank you very much.